We still have patients calling our clinic, which has been shut down for 6 weeks now, wanting to know where they can go. And we have to tell them these are the states that you can go to, but we can't give like a specific referral to a provider.
Let's talk about cases where somebody isn't necessarily seeking an abortion, but women have medical issues during pregnancies. And you're worried that women who might be having a miscarriage are worried that they're going to fall into this legal system somehow. How does that play out?
I fully see the Alabama legislature and other state legislatures going towards the criminalization of miscarriage in general. Because if you can't prove that you didn't take mifepristone or misoprostol, the abortion drugs, then there's no way for them to prove your innocence, because there's no test that can tell anyone if you took it or not. So every miscarriage is going to be investigated.
I mean, but we're talking about a Class A felony, you know?
Yeah.
This isn't
a parking ticket.
Yeah. This could permanently alter someone's life, right? And I think one of the common misconceptions about the Human Life Protection Act in Alabama is that it only applies to doctors and providers. It actually applies to anybody. So if you give your daughter an abortion-inducing drug or substance, not even a drug when intended to, but a substance that could potentially complicate a pregnancy and ultimately end a pregnancy, you could be charged with a Class A felony. It also criminalizes the attempt. When you start getting into attempt, that really lowers the standard on what sort of conversations lead to a particular outcome, and also increases the likelihood that you could be caught up in an otherwise normal conversation with someone about what their options are, and ultimately end up being investigated and arrested.
Just by a show of hands, who here feels the effect of this chill that we're talking about? Okay, it's pretty clear.
Every time I hear abortion ban, I hear a ban on your bodily sovereignty. For example, I cannot force somebody to have a C-section because their baby's in trouble. I've actually had to watch, during the labor process, a baby die in labor because the patient didn't want a C-section. I cannot force her to have a surgery that she does not consent to. That is not my call. And yet we have people in official state government positions making those calls for people they've never met, have no interaction with, and also have no training to make those calls about. Abortion is healthcare. You can believe the earth is flat, does not make it so. And so what we see now is on a government level, state by state, also the Supreme Court has decided that access to healthcare is not important, and that the maternal mortality rate on the rise is fine. It's not fine.
They don't think it's unimportant. They know who's going to be most affected, and they're unconcerned. That's right. So they're not concerned with Black and brown people, queer and trans folks, disabled folks. They're like, they want to widen that gap between the have and the have not. It's not that they don't care
and
about,
if they don't
or see
think
it as healthcare.
that a nationwide ban is their ultimate goal, why would you have these laws that are saying that you can't even give a referral? Okay, abortion's illegal in Alabama, but you can't even talk to a patient to tell them what state to go to, or they're passing or in Missouri or in South Carolina where they're putting these things, in place where, no information can be given, or you can't even drive anybody to an abortion clinic. So why do you think they're passing these laws in these states? Because their main goal is a nationwide ban on abortion.
We don't believe that birth control is going to be accessible or available or legal in Alabama for too much longer, because there's too much control right now. There's too much control in the legislature to overturn it. Birth control is already extraordinarily impossible to get in Alabama. For the most part, the only place you can get it if you are low income and uninsured is from a county health department. And it's some 2, 3, 4 month wait in order to get in to see somebody for it. So although
let me just be clear on this. If you do not have health insurance or other coverage, and you're a woman who'd like to be on birth control in the state of Alabama, you could wait 3 to 4 months to get an appointment
Absolutely.
to get that.
That's how we ended up with so many people at our clinic.
And you have to wake up at like 8 a.m. to call the clinic.
get
It's not
birth
like an
control.
To get
easy.
birth control.
It's not like an easy call, make an appointment, go there. That's not the case. You wake up at a certain time. You got about a 5-minute window of waiting on the phone if you get through on that day to make it down there to get an appointment. So it's not an accessible thing.
We had legislation introduced that would have given employers the ability to determine if you had access to birth control.
Birth control insurance for birth control.
We argued about that in the legislature about whether or not an employer can tell you that you can get birth control or not.